Welcome back to Take Care with the Rowing Therapist. I'm your host, Danielle Wagmeister. Today, I'm honored to be joined by Dr. Erin Bellamy, a UK-based chartered psychologist and pioneering researcher in the field of metabolic psychiatry. Dr. Bellamy holds an MSc in Psychiatric Research from King's College London and a PhD in psychology, where she explored the impact of ketogenic diets on mood and brain function. She's the founder and CEO of Integrative Ketogenic Research and Therapies, a clinic and training platform dedicated to using ketogenic metabolic therapy to support conditions such as depression, anxiety, and bipolar disorder. Her work bridges rigorous science and real-world clinical practice, bringing dietary interventions into mental health care with both science and compassion. In this episode, we explore how nutrition can shift brain chemistry, discuss real case examples, and examine emerging topics like eating disorders and the intersection of ketogenic therapy with GLP-1 medications. Dr. Bellamy, thank you so much for being with us today.
Absolutely. Thank you so much for having me. It's an honor. I'm so glad to be here.
Oh, thank you so much. So you're one of the few psychologists in the UK working at the intersection of nutrition and mental health. What drew you to ketogenic therapy in the first place?
Yeah. So it was it was a bit of a long journey, and it's not something that I had planned. I think if you ask anybody within this field of metabolic psychiatry, nobody planned to be here because it didn't exist, 5-6 years ago. But really where it started off was I had an intense interest in nutrition and eating disorders and eating behavior while I was studying psychology. And that kind of stuck with me. My thesis at my undergrad was looking at students and their eating behavior during exam time. Then in my master's, I was looking at how individuals deal with their emotions when they have eating disorders. How do they process emotions? So that was always with me. And it wasn't until I was working in the National Health Service here in the UK on an inpatient psychiatric ward, so with people who were really quite unwell, they're spending some time in hospital. I came across the ketogenic diet and a low carbohydrate diet, and I started to research it, and I started to see that some of the secondary outcomes, so not the reason the research was done, but kind of the secondary outcomes, things that they found as well as their main outcomes. So these secondary outcomes were improvements in mood or improvements in quality of life or, less anxiety, less depression. And I thought, this is interesting. Perhaps there is a way to use nutrition to improve the lives of the people that I'm working with, improve their symptoms, improve their depression, their anxiety. And I came across some research from the mid-1960s using things like a ketogenic diet for schizophrenia, and that looked quite positive. And that was the catalyst that sent me on the path. So I went off then and I started my PhD research looking specifically at a ketogenic diet and using this as a metabolic therapy to improve mental health outcomes. So it was quite organic, but it wasn't my plan. It's the way I was led, and I followed that interest. And if I hadn't found that research, then I'd probably be doing something very, very different right now.
Yeah, no, that's fascinating, and I really appreciate hearing your story. I've had a guest on here, Dr. Mary Newport. I don't know if you're familiar. Same thing, where she did some research because of her husband developing Alzheimer's, and that brought her to this as well. So very interesting that a lot of times it's in search of ways to support health and healing that people are finding this. So I appreciate hearing that about you. What was the biggest challenge when you started bringing keto into a mental health setting?
Mm-hmm. In the beginning, and I think it's still very much like this now, within the UK at least, We have a very specific way of treating mental health. Psychiatrists have specific guidelines that they need to follow. Psychologists have a role, and they will only see patients at certain times. We have extreme waiting lists for even assessments, never mind getting to see, a psychologist for therapeutic input. And so that is the way that mental health is approached here, and there isn't really any room for anything else. Within the UK, we also have a system where our National Health Service is free at the point of service. So, if we need to go to the doctor or we need to go to the hospital, we go. We don't have insurance companies. We don't pay for insurance or anything like that. We go and we've paid it through our taxes. So the only way you could get some alternative support is if you were to then go and pay privately, find a private nutritionist or a private dietitian, something like that, where you might be able to explore kind of alternative therapies. And so the biggest challenge, I think, has been trying to get people to understand that this is a new kind of, well, it's not really new, it's been around for over 100 years, but in terms of using it for mental health, it's a new but very promising area of research and clinical application. And because the professionals are so stretched, and because they have very specific ways of treating conditions, there is not that much open-mindedness about wanting to learn, about this kind of thing. And we're still waiting for a lot of the randomized control trials to come through and be published, of which we've got 12 or 13 underway right now. And so, people are not as curious as perhaps I would like. Having said that, there are lots of people who are, and it's wonderful to see that. But I think the biggest challenge has been, trying to explain to people that this is not, if implemented safely and correctly in the right way, this is not a scary thing. This is not something that is going to damage your health. If you do it incorrectly, maybe, but if you do it properly in a therapeutic manner, it can be extremely powerful. And trying to explain that to people has been the biggest challenge, to try and get them on board as part of the team supporting, their patient or my client. Aside from that, you would think that perhaps the people who are struggling the most with their mental health, that it would be really difficult to get them on board. But, they're the ones that have tried everything, and for many of them, they are not getting the relief that they want or were promised, and they are looking for anything else to help support them. So when it comes to something like a nutritional intervention that's relatively low risk, if done properly and safely, then they're all on board. They want to do anything that's going to improve their symptoms, both physical and mental. But yeah, so I think the professional dynamics would probably be the biggest challenge at this time.
Yeah, that makes sense. For listeners who are new to this field and this idea, how would you describe metabolic psychiatry in plain language?
Yeah, so I know it's a bit of a tricky one, because I've said things like ketogenic and I've said things like low carb, and then there's metabolic psychiatry. Like, the words are not words that we would just come across in, day-to-day discussion. But metabolic psychiatry, if we split that apart, metabolic, so comes from the word metabolism, which is how we process nutrients and how we make nutrients from our food. And so those nutrients then fuel our body and make us do what we need to do. So that's the metabolic side. So we have a metabolism and we have to look after it, because if we don't look after it and it gets damaged or it gets sluggish, then we run into physical and mental health problems. The psychiatry part has been added to the word metabolic because what we're looking at, or what we're trying to target here, is improving mental health symptoms. And so one could argue that maybe metabolic psychiatry is not the correct term, but it's a term that has been put out there for the field for now, I think. It's just showing you that we're looking at using and improving metabolism to improve mental health outcomes. And so mental health being the field of psychiatry, you could also say psychology, you could also say metabolic mental health if you wanted to. But that's what we're doing. And there are a couple of ways that we know how to improve metabolism. And the way we do that is by using things called metabolic therapies. Metabolic therapies improve your metabolism. The metabolic therapy that I'm most focused on using is the ketogenic diet at a therapeutic level, which is a very low carbohydrate diet. And then there are other metabolic therapies that I use that are also beneficial, like sleep, light, movement, and so on. But the ketogenic therapy is the foundation. So that's kind of what it means in short. Does that help?
Yes, very much so. Anything that excites you more in these brain mechanisms, such as mitochondria, neurotransmitters, insulin signaling?
I think, to be honest, just the sheer amount of mechanisms that we have at play with these ketones is what excites me the most. Because when I was doing my PhD, I was looking specifically at depression, and I was trying to see, well, what are the mechanisms of depression? How many are there? There are plenty. And I was thinking, well, can I find mechanisms of ketones that can counteract the mechanism of depression, right? For example, if one of the mechanisms of depression is inflammation, right? So you get inflammation, chronic inflammation may cause depressive symptoms. Well, then ketones are anti-inflammatory. So depression has the inflammation going up, and the ketone comes and bring the inflammation down. So I was looking for those counter mechanisms. And with depression alone, I found 52 mechanisms of depression and 52 mechanisms of the ketones whereby they could counteract those mechanisms of depression. So then I stopped because I'm not a biochemist. That's not my job. I'm a psychologist, right? That's what I'm researching. And so that tells me that we are just scratching the surface in terms of understanding the mechanisms by which ketogenic therapy works. We've got neuroinflammation that the ketones help, insulin signaling, like you said, neurotransmitter imbalance, brain glucohypometabolism, mitochondrial dysfunction. We've got so many of them, and I think there are so many more. But that's what's so exciting, because we are seeing people improve, and we still don't know what their mechanism of action was for their illness. We don't know if it was insulin signaling or neurotransmitter imbalance or insulin resistance. We don't know, right? But the therapy is working, and therefore people are feeling better. So I'm just excited to know that these ketones are doing so much more. They're doing the heavy lifting. They're doing so much more than we even know right now.
Oh, that's exciting. So can you walk us through one or two cases where a ketogenic approach made a dramatic difference?
Yeah, absolutely. So one of them, the first one I can share is one that I recently published in Frontiers in Nutrition. So it's free to access if anybody wants to go online and find it. Just pop my name into Google and it'll come up. So this was a 39-year-old woman who came to me. She actually joined my group program. So she didn't work with me one-on-one. She joined a program that I run every couple of months in a group of like 7 to 10 people. And with the group, what I do is I educate people and kind of help them implement the diet and then support them over 6 months or so. So when she came to me, she was really, really, really unwell, right? She wasn't feeling well. She had multiple diagnoses, lots of different symptoms. So there was depression, anxiety, bipolar type 2, ADHD, binge eating disorder, PTSD, PMDD. So, quite a complex case, should we say. And when people come to me, in the beginning, what I do with everybody is I ask them to complete a couple of psychological assessments, like self-reported ones, so we can get a baseline to see where they are. And then over time, we do them every couple of months and we see if there's any improvement and see if what they feel matches what we're seeing. And so the baseline scores for PTSD, for example, was the highest that it can be on the scale. The binge eating, the depression, anxiety was all very, very high. She had also really struggled with, like I mentioned, with the binge eating, with sugar. She had a real tie to sugar. She was a self-confessed like sugar addict, right? And so in the first couple of weeks, she saw a dramatic improvement in her symptoms. And over the course of 12 weeks, and then even up to this day, she has found, in her words, complete remission from all of these diagnoses. And when we did the charts and we did the assessments, everything had come down to 0. So the PTSD went from 80 down to 0. The depression, the anxiety, the binge eating, she went from, being addicted to sugar, in her words, to not being at all, as long as she stayed in ketosis. If she comes out of ketosis, then those cravings come back as they do, right? But as long as she maintained therapeutic levels of ketones, she was able to sustain, or is able to sustain, those improvements. So, in just a couple of months, really it was the most incredible case that I've ever had. Wow. Where she was able to go from that and completely turn her life around and get symptom relief, and now is doing incredible things. She's doing really, really well, and she's, she was grateful, I was grateful to have her share her story and let me publish it. And yeah, she's doing really well. So that's the first one. And it just
Great.
shows you that, again, the diagnosis label, it's important in psychiatry and psychology, because then you get the diagnosis and then you can get the treatment that, the professionals think that you may need to try, and that can be helpful. But when it comes to metabolic therapies, doesn't really matter the diagnosis. The diagnosis can guide a practitioner. It can help me understand what some of the risks might be. I can then have a look at them. I can have a look at the medications and see what the risks are there. But really, we're treating the symptoms. And, she had multiple diagnoses. So how would you even begin to treat that with different medications and different therapies, one for each? It would be too difficult. Whereas we have one intervention that helped to resolve all of them. So it shows the kind of transdiagnostic kind of nature of this therapy, that it can work across all of these diagnoses.
Yeah, that's fascinating.
Another case is another young lady who started with me just over a year ago. And she's going to be sharing her story at a conference soon. So it'll be lovely to actually meet her in person, because I haven't met her in person. And when she came to me, she had been trying a ketogenic diet for a while herself, and she'd seen some improvements. She was doing it to lose weight initially. And she'd seen some improvements in her symptoms. And by the time she came to me, and she had said, my diagnosis is schizophrenia. I've been experiencing 8 hours or so of hallucinations every single day. And since going into ketosis, something seems to be happening. Something is changing. So she too joined my group program, and we worked together for a while. And at this point, when she's in ketosis and maintaining ketosis, she can have as little as 30 minutes of hallucinations a day. So she's gone from 8 hours of constant hallucinations down to just 30 minutes a day, which is, like, if you imagine the impact that would have on somebody's quality of life, their ability to get up in the morning, to do anything, to show up, in life, 8 hours of hallucinations, you're not going to be able to do much, right? Whereas when it's down to 30 minutes, you got your life back there. Yeah, there's still room for improvements, of course there is, but you have seen such great improvements that she can do a lot of the things she wants to do now, and she's doing great. So yeah,
Yeah.
there are just two examples for you that I have the permission to share. So
Wonderful. Thanks for sharing those. It's incredibly encouraging, especially hearing in the first example that person started noticing a difference, it sounded like within a few weeks.
yeah,
So pretty fast acting.
yeah,
Yeah.
it can be so. Usually the average is we kind of look about over 3 months or so. Are people improving within that time? And usually people do. But some people take longer. It kind of depends on a whole bunch of things, whether it's they're older, more complex, maybe there's multiple medications, physical and mental health medications. Could be how difficult it was for them to initiate and to stay at a therapeutic level. So for some people, it could take, you know, months and months before they start to see the improvements, because the metabolism takes a while to fix itself. But there are, like I said, there are some cases where it's almost like night and day within a couple of weeks.
Yeah.
And it's truly incredible to see that.
Wow, that's amazing. And you mentioned some of the other therapeutic supports that might stay in place. I'm just curious how that looks like. For an example, if someone comes in and they are, like here in the US, it's not uncommon somebody to say, I'm taking 11 different medications. Because it does seem to be kind of more the trend here too. Oh, you have a new symptom. Well, here's a new pill for that. And before you know it, we're on all these pills. So is part of the goal when you're working with someone to reduce medications? How does that work?
Mm-hmm.
Do they stay on medication? And is there any other therapeutic form of support that you find beneficial to keep in place alongside the diet intervention?
Yeah. So in terms of other tools, we focus on ketogenic therapy first, and there's kind of a lot of different ways to get into ketosis and maintain that. There are different strategies, different ways of eating, different supplements that can help. So we employ all of those so that there's always a way to stay on track. And then when it comes to the other metabolic therapies and bringing those in, we bring those in because they too can influence the ketone level. So over that couple of months that we'll work together, excuse me, I'll teach them how to use all of those individual tools and when to use them. When is it beneficial? Some people, it's a dream for them because they can just get into ketosis, have really good ketones, and don't really need to do much else. But then other people really need to pull at a couple different levers and use different tools to help, get them to where they want to be. So everyone's a little bit different there. When it comes to medications, I'm a chartered psychologist, so I'm not a clinical psychologist, and I'm not a psychiatrist, so I can't I can't adjust medications or anything like that. But what I do with people is I teach them, what to look for when it comes to medication potentiation. Most people have never really looked at the side effects list of their 11 medications, right? Or the medications have changed so much that, it's a lot to read, and it's a lot to try and hold in your head if you've got lots of brain fog and you're depressed and anxious. So we talk a lot about trying to understand what it might feel like to have the medication acting too strong. And so this can happen for people from anywhere from like week 4 up to a couple months in, where ketogenic therapy is working well enough, like the mechanisms are at play, the antidepressant properties, the anti-inflammation, the anxiolytic properties, reducing anxiety. The ketones are at play so much so that the medication dose that they had or were taking at the time is now too strong for them, because the ketogenic therapy is working and the medication's working. So it's kind of like a double whammy. So I teach them how to identify that. And then if and when that time occurs, when they are experiencing it, then what they do is they go to their provider, their psychiatrist, their doctor, and they have the conversation. They say, hopefully, ideally, they will have already told them what they're doing, but then they'll go and say, listen, like, this is what I'm experiencing. Can we have a conversation about it? So the goal with ketogenic therapy for mental health is not to come off all your medications, right? Some people will use ketogenic therapy to offset some of the negative side effects of medications. Some medications will, impact insulin and will make people gain a bunch of weight. That's not, people don't want that. They can use ketogenic therapy to bring their weight down and improve their metabolism, and then also have the medication working on, whatever symptoms it is working on for them. So the two can work adjunct. And when people come to me, that's where we start off. Medication's working and ketogenic therapy is being added. But then there are some people where ketogenic therapy works really well, and the ketogenic therapy is then holding the ground, and it's giving them the benefits. And if the medication's too strong, then the psychiatrist will support them. They'll make a plan together to slowly, very slowly reduce the medication over time. The potentiation effect, so the feeling of the medication being too strong, that should subside once the medication has been slowly dropped. And so, it could take a year, 2 years for somebody to come down on their medication substantially, but they still maintain the ketogenic therapy as their main therapy. They look at it as, this ketogenic therapy is holding me just like my medication was. So it's not like, oh, I just do this diet whenever I want and I'm not on any medication. No, you have to, if it works, maintain ketogenic therapy with the same level of commitment and seriousness as you would your medication. Because if you take it away, at least in the early days, your symptoms can come back very, very quickly, just like if you were to miss a dose of your medications. Yeah. So it kind of shows that there's variation, right? It's not a one size fits all. You don't have to come off your medications or anything like that. The most important thing is finding something that works, that helps your symptoms improve, and making sure that you've got lots of different tools. So just like you asked, like, what are the other tools? Well, ketogenic therapy is one. That's a good tool. Being able to use medication ad hoc, have a discussion with your psychiatrist, and then you have a plan. Should something happen, I don't sleep for a few days, or something terrible happens, you're really stressed out. Well, you have a plan to also use medication. Maybe you also have a therapist that you see, right, to work through some things, or a coach to help you kind of re-envisage what your life can look like next. So there's kind of different tools for different things. It's not just one tool as like ketogenic therapy is a magic bullet. No, you need to be able to kind of pull on a couple different things, but ketogenic therapy is a very big part of that. Does that kind of help to kind of answer the question?
Yeah, absolutely. No, I appreciate that. And I also appreciate your point around it being a therapeutic intervention. So not something you commit to and don't, oh, today I'm going off of it and that kind of thing. So are there ever situations where keto doesn't help or made things worse, and anything that you've learned along those lines?
Mm-hmm. Yeah, so for some people, for many people actually, in the beginning, things can get worse before they get better. It's, there's a little bit of, you're switching fuel sources, so your body's going to take a little bit of time to adjust. That's normal. But also, you're really trying to overhaul your life. You're starting a new diet. You're learning about macronutrients. You're trying to figure out what to eat when you go out on a Friday. You're trying to figure out what to tell your mother-in-law. Like, you're trying to prepare your food. Like, so all of those things are stressful. And so the first couple of weeks, couple of months, they can be a bit up and down, and symptoms can get worse before they get better. But after maybe about 2 months or so, really by that point, people should kind of be in their groove and seeing improvements. Now, the question is to, have I seen anybody who's not got better? Out of hundreds of people at this point. I can still count on one hand people that haven't had perhaps the response that they were looking for. And I say that because everybody improved somewhat in those people that didn't fully respond. And the thing is, with ketogenic therapy, it's not that like we're using it to improve mental health, but it's also improving physical health. It's improving health in general. So it's improving your insulin sensitivity, right? It's reducing inflammation. It's giving you better energy. It's clearing up your skin. It's making you sleep better. It's reducing it's removing your risk of hypertension, removing your risk of type 2 diabetes and pre-diabetes, reducing your risk of Alzheimer's, dementia, and other illnesses that are so common. So all of that is an improvement, even if you didn't see any mental health improvements, right? And oftentimes when people say, in the early days, oh, like, I don't see any mental health benefits yet. Like, okay. And then they'll go and have a bunch of carbohydrates, and then they'll say, oh my gosh, get me back into ketosis because I'm just so tired and lethargic and irritable. Like, I just can't eat like this. So they feel better in ketosis. So for those couple of people that I'm thinking, they still saw marked improvements in their physical health. With the mental health side, things improved, but it didn't take them the whole way. And that's still what we don't quite know about ketogenic therapy yet for everybody, is we don't know who's going to respond, and we don't know how well they're going to respond. We also don't know if what they are looking for is realistic or not. For example, if you've been unwell for all of your life, you have an idea as to what normal feels like, but you've never experienced it. So you might come all the way down on your scales down to 0, but you might be saying, well, life doesn't feel that like it's better, but I don't feel 100%. But that may be because the expectation of what normal looks like is very different. And then also, sometimes there are other things going on. So symptoms may improve, depression comes down, anxiety improves, mania stabilizes. But then there may be some lingering symptoms. So for one or two people, maybe there's just a little bit of like cyclical depression that won't go away, or maybe some paranoia that won't go away. And what I do in those cases is I ask them to go and see like a functional medicine practitioner or a specialist to look specifically a little further or a little deeper to see what might be going on. Because I've done everything that I can, and often what happens is they'll go, and then for a couple of people that I'm mentioning, it comes back that they are, they've got mold issues, or they've got heavy metal issues, or they've still got some like gut issues that haven't been resolved. So it's that, that's outside of ketogenic therapy. Ketogenic therapy, metabolic therapies will hold the foundation. But if you've still got those lingering issues and that's what you're dealing with, you then need to go on a different journey, to figure that out and fix that with that individual. So it's not that the ketogenic therapy didn't work. It worked as well as it could and eliminated a lot of the negative symptoms, but then there was still something lingering that the ketogenic therapy is not going to help, which is removing the mold or removing the heavy metals. But still, that's just, on one hand, I think it's about maybe 4 people maximum, over the past couple of years. So it's very, very few. Yeah.
Yeah, no, and such a great idea to be looking at the bigger picture if they're not seeing the results. And so thank you for that. Keto is sometimes controversial in the eating disorder community. How do you approach clients with a history of having an eating disorder?
Yeah, it usually depends on what kind of eating disorder. And so with things like binge eating is not relatively easy to deal with, but the food noise quietens down very, very quickly once you're in ketosis. So as long as we can get people into ketosis and they feel that relief, then it's just a matter of, okay, how do we sustain this, right? And the binges, it's not about trying not to binge, it's just they don't binge because there's no food noise telling them to binge. So that one is pretty good. With the things like bulimia, I actually don't have much experience with people with a diagnosis of bulimia. They haven't found me yet, maybe. If I'm thinking just of the one individual that I've worked with, it was more on the side of binge eating. So there was less of the purge tendencies and more of the binging. So once we were able to get her into ketosis, those urges went away. And if there's no binges, well, then there's no purges. So that stabilized. When it comes to anorexia nervosa, there's a fantastic doctor, Dr. Guido Frank, who's out in California, San Francisco, who's been doing the research on ketogenic diets for anorexia nervosa with really like positive results so far. And anybody that I've had who's come to me has been kind of weight stable, so they're not in the process of losing weight, they have stabilized. And it takes a lot of work, and usually if I have somebody who has that diagnosis, I work as part of a wider team. So I'll work maybe with their psychiatrist, psychologist, nutritionist to help them to keep things ketogenic, because they need a wraparound team. There's more than just the nutrition involved, and also there are more risks when it comes to refeeding and things like this. So what I have seen is that, again, the food noise just seems to go away. There's more calm, there's more GABA, so there's more calm, and they are able to maintain ketosis, which is what they had been doing when they were losing weight and fasting. They had ketones, they had energy, they like that state, but they can have the ketones in a fed state through ketogenic therapy. So it seems that, that's where they see the improvements. Out of all of the eating disorders, the majority of people that come to me, it's binge eating or binge eating / food, ultra processed food addiction, that type of thing. And really these days, it's a lot of people. One, it's comorbid with a lot of mental health conditions, but then also, the more people are talking about it, then the more people are seeking the support that they need. So it's more so that. Mm-hmm.
Okay, that makes a lot of sense, especially when you consider that so much of our food is processed to be highly addictive, that once you clean the diet up with those things, that makes it less likely that people are going to be binging on that. So that makes a lot of sense. So another trend that's really popular right now is the GLP-1 medications. What are you seeing in your clinic? Are clients arriving already on these drugs?
Mm-hmm. There's a little bit of that, but not as much as you would think. I don't know if by the time people find me, they're medication fatigued. They don't want something else. They just want, they want less of that. But what I do know is that when it comes to using the GLP-1, where, there's a lot of downsides. There's a lot of upsides, but there's a lot of downsides. Where I have seen it can be helpful is in the beginning, if people are really struggling to get into ketosis and they've tried everything with either me or with another professional, and they're just not able, to get the food right long enough to get into ketosis for whatever reason, and we've tried all the different approaches, a very low level of GLP-1, provided by the doctor, can be helpful for a couple of weeks just to quieten that food noise, because that's what it does, or it's one of the ways it works, so that then that individual can get into ketosis. And then once they're in ketosis and they start, we continue with the program. They eat in a ketogenic way. They do all of the things. Then you can slowly start to remove the GLP-1. So you use it pretty much as a ramp. So a ramp into ketosis, because they couldn't get there initially. And then once they're in ketosis and maintaining ketosis, then you can remove the GLP. Because in terms of things like weight loss, the ketogenic diet is excellent as a weight loss tool. It's also lean mass preserving. Ketones, we need fat to create ketones, and the body would prefer to use fat and ketones to burn rather than lean mass. With the GLP-1 drugs, it's not the case. We see a lot of fat loss, but also lean mass loss, which is concerning. So with the ketogenic diet, it's preferential to use that to lose weight. And also, you then don't have a medication that you have to continue to take long term in order for you to sustain your weight loss. You use the diet and then you maintain your loss with the diet. You remain in ketosis and you remain in that fed state while maintaining your weight loss. So it's helpful as a ramp, but not really in any other situation. And also what we see is that if people are using GLP-1s for a long time, they can become, kind of averse to certain foods, especially things like protein and fat, which is not very helpful because protein and fat, that's where we get our nutrients from. That's how we stay nutrient dense, that's how we get everything we need. So there are some of those concerns further down the line if we are having those aversions. So I try not to, if somebody comes to me, I want to try and get them into ketosis quickly so that they can remove that if possible.
Okay, yeah, sounds good. What labs or medical supervision do you consider essential before starting a ketogenic protocol?
Yeah, this is good. So usually I would recommend people to tell their doctor or provider or prescriber what they're doing. They don't have to, but it's better to have more people in the know and involved. Sometimes they'll be interested, sometimes they won't be, and that's just how it goes. And so I make sure that they've got everything that they need to share in terms of literature and information. And then we usually run, depending on the individual, depending on their medications, their diagnosis and so on, we'll get a baseline blood panel, so a metabolic panel, and then depending on all of those things, we might get some other baseline measurements as well, especially around medications. Depending on the medication, you need different information. And so, when those come through, then their prescriber, doctor has them. I can have a look at them too, but it's mainly for the prescriber to have them so they know what the baseline is. And then if anything changes, if they need to change or adjust medication, then they can do that. And then we will test again, a couple months down the line and see what's changed. And, if anything is of concern, then we can make adjustments or add supplements, that type of thing. So really it's just getting that kind of baseline bloods and informing the team to say, what's going on and making sure that everybody's pretty much on board before they get started.
Okay, yeah, that sounds great. So are you collaborating with the other team members, like their psychiatrists, or is this just pretty much done through the client themselves?
Yeah, so it's a little bit of a mix of both, depending on, what the individual needs. If you're in the UK and you're under the National Health Service, the National Health Service, I think I can only think of 2 people that have managed to get any part of their team to collaborate, because it's just they don't have time to do that. So if it's an NHS client, then it's likely just to be them and I just help them to advocate for themselves when they go into meetings with different members of their team. And then with maybe more complex cases, for example, people who are in inpatient units, for example, or a very complex case if they're elsewhere and perhaps a parent is making the food for them, then I'll be part of a wider team, and that will just depend on what their needs are, whether it be other nutritional professionals or mental health professionals, or maybe some other more specific medical professionals, depending on what the issue is. So I can kind of do both. a lot of the people that I work with, they just come on their own, and I help them advocate for themselves. But then I do have a couple cases where I work as as a single part of a wider team.
Okay, yeah. I was appreciating when you were saying earlier about how when you were running these groups, there's this education component, teaching them what to look for, then having this conversation with their psychiatrist about adjusting medication if needed. And I just appreciated all the education that goes into helping people assess for themselves and be able to feel empowered in having those conversations that can be intimidating sometimes. So appreciate that approach. So where is the strongest research heading next around specific disorders, biomarkers, or age groups?
Mm-hmm. I think the most research we have right now is on bipolar disorder, but really we are taking an approach where we're all guns blazing. So, as part of, being a researcher and a clinician in this metabolic psychiatry field, we are very lucky in that I'm in close contact with lots of the other researchers and clinicians, and we meet regularly to discuss, like, well, where are the gaps? Where do we need to focus time now? What are people saying that they need? What are the sticking points? Is it education, or is it access to services, that type of thing? So we're constantly looking at that and reevaluating it. In terms of the areas, I think the research is going to be done on individual conditions anyway, because that's what the medical establishment want to see. That's what researchers want to see in journals and so on. So that will go ahead. But I think people are realizing that it is more transdiagnostic, this therapy, and that we can use this therapy to improve people with multiple diagnoses, both physical and mental, and their comorbidities. So I think a closer look at that is quite exciting, because people that say, oh, I've got a broken brain, I've got all these different conditions, well, you may not be broken, right? I'm sure there are things that we might be able to do. In terms of age groups, I think the most exciting thing right now is that to date, we've mainly been looking at adults, but actually there is a research study underway right now in the US. I can't remember which state it is. I think it's the Children's Mental Health Center. They are a charity, and they're doing research using ketogenic diet for mental health in children. And so, as you and I know, especially in the States, there are a lot of children on a lot of medications from very early on, really young children on medications. And so if the ketogenic therapy, can work for them, and if the outcomes are good, well, maybe those medications may not need to be used, or may not need to be used in that dose or in that way. So that's quite exciting. I think it's still in the early stages. The study's still in the early stages. But if anybody's interested, they can check out the Children's Mental Health Center. I'm pretty sure that's the name of the charity, to see if they can learn more about it.
Oh, that is fascinating. Yeah.
Mm-hmm. Yeah.
So if you could run any clinical trial with unlimited funding, what question would you want answered first?
I'm glad you asked this. So recently I actually was honored to receive an award, like a Metabolic Psychiatry Scholar Award. So I got some funds to run a trial, and that trial is my dream trial. So this is your answer, is the one that I'm going to be doing, which is it's taking the group program that I have and seeing if it's scalable. So first of all, seeing if it works. I can see it works in clinic because I've been running it for a long time. But does it work, as a research study? Do we get good outcomes? And then if so, is it scalable? And as the program is online, it's all remote, well, then it is scalable. So then how do we make it scalable, and what does that look like? Because, there are people that are in Alaska that need this support, and then there are people in Papua New Guinea that need this support. So geographically, your position geographically shouldn't be a barrier. how low you feel in terms of not being able to get up and leave your house to go and see a doctor or get to an appointment, that shouldn't be a barrier for you accessing help either. So with a remote model, you could lie in bed and you can be on the internet, you can be engaging in the program and seeing benefits from your home. And so I believe that that's how we can reach, more people. That's how we can reach the masses. And also we need it to be, it can't just be one-on-one. Well, it can be one-on-one, but we're not going to help that many people if every clinician is just working one-on-one. We need to find ways to be able to help people with the same results or as close to the same results, but on a wider scale. So they get community and we reach more people. And so that's what I'm working on, and that's going to go over the next 2 years, and we will see at the end what the outcomes are. But I'm really excited about it.
Yeah, that is exciting. Yeah, I'm super excited to hear more about that.
Mm-hmm. Yeah.
So, personally, what practices do you use to keep your own mental health steady while running a clinic and conducting research?
Yes, love this. So it's been pretty much the ketogenic diet from the beginning. And I'm very fortunate in that I've never really struggled. I've never really struggled with depression, anxiety, that type of thing. But when I'm in ketosis, I feel a difference, and I need quite high therapeutic levels of ketones to really feel like my brain is firing on all cylinders. And running the business, doing the research, getting through the PhD, I needed my brain to work. And so having the high levels of ketones is really what's helped me. When they drop low, then I feel more unmotivated. I don't feel like I can concentrate as well. I'm not as productive. I'm still productive, but it's just not at the same level as when my ketones are higher and I've got that constant energy. So I like to stay in ketosis with those higher levels. Sometimes I come out, but then I can relatively easily bring myself up. I'm quite fortunate in that my body likes to make high ketones, so I don't struggle to get them up. I'm quite lucky. And so that's what I like to do. Sometimes I'll use maybe things like MCT to help me. But that's my main lever in terms of kind of getting me through things, is keeping the ketones up at that level, because that's where I'm going to function my best.
Ah, beautiful. I heard you mention on another podcast you also like to listen to Pink Floyd, which I thought was really cool. So I had to bring that in. So,
yeah,
but
that too.
Yeah, wonderful. So Dr. Erin, how can people find out more about you, your work, your research? How do they reach you?
Yeah, absolutely. So you can put my name into Google and I'll come up, or put me into YouTube and I'll come up. There's a bunch of podcasts in there now that you can listen to if you want to know more about me, my research, and so on. But also you can go to my website, which is IKRT.org, so Integrative Ketogenic Research and Therapies.org, and that's where you can stay up to date. I've got a newsletter, you can have a look at the programs, you can read about what I've been doing, and you can read about the research. And then you'll also find me on social media, so things like Instagram, Twitter, and LinkedIn. I think they're the three that I have. So you can find me there. And if anybody wants to get in touch, you can just get in touch directly through the website. I'm not a huge conglomerate. It's not a huge company. There's just myself, and I have a wonderful admin who works really hard with me, and so it's just the two of us. So everything's really quite personal, and we know all of our clients really well. So if anybody is looking for a bit of extra support, then just get in contact, and we'll take it from there. But yeah, thank you for asking me where people can find me.
Yeah, absolutely. Thank you so much for your wisdom, your expertise, and all of the amazing contributions to this growing field. So just want to thank you again for being here. And to our listeners, thank you so much for tuning in. Appreciate you liking, subscribing, hitting that notification bell so you can hear new episodes as they're released, and taking a minute to share with someone you feel might benefit from this. Thank you. And to everyone, again, as always, take care.